Welcome back. I'm Manali Kulkarni, nutritionist at Endoclinic, Pune. I welcome you all to the series of life-changing thoughts about diabetes. In this video, we are going to talk about what is personalized health goal. When I started working with Dr. Anjali Bhatt madam, I was exposed to very new and effective way of managing type 2 diabetes, which is very scientific, systematic and based on personalized health goal. The result that my patient achieved were so impressive that I could not resist sharing the experience with you all.
Chronic disorders are like diabetes, are lifestyle disorders and they remain for lifelong. And that is why it is very difficult to separate them from your life. And life, as you all know, is ups and downs. It's dynamic, it's changing, it is phasic. So in different phases of life, different people look for different things. We have goals in different phases of life. Like students, we are trying to achieve better education. As professionals, we are trying to achieve better designations. We are trying to achieve promotions. Similarly, health goals can also be changing. So for example, if I come across with a young lady of 25 to 30 years of age, she's coming to me because she's not able to get pregnant. So this is her personalized health goal for that particular time. So when I manage her diabetes, or for that matter, when I manage her weight, obesity or nutrition, what I am looking for is a personalized health goal which will help her to have a better metabolism that will suit her requirement, that is going to be conceiving and having a very healthy pregnancy, throughout which her metabolism will remain normal, and we will be able to make sure that the child's metabolism as well as long-term health is normal. So these are, I would like to call them as personalized health goal. For somebody who is coming to me, a 60-year-old gentleman needs to get a cataract surgery done. And for that he is coming to me, we need a good glycemic control. This can be a small health goal. For somebody whose day-to-day activities are affected because of excess weight, weight loss can be a personalized health goal. For somebody who is overweight and has developed recent onset of type 2 diabetes, my health goal would be reversing the diabetes by controlling the weight. So in different phases of life, different people will have different life goals. And diabetes being a lifestyle disorder, the management of diabetes can also change according to the personalized health goals. So this is possibly one of the most commonly asked questions to the doctors and nutritionists as to what should I eat and how much should I eat and when should I eat. Now these are three common questions over which there are innumerous diet trends happening in last few decades, I would say. Because India is a country of huge variations in the food quality, the way we cook, the grains that we use. If you travel from North India to South India, there are innumerable varieties about what kind of food we have available. Now, when it comes to deciding a scientifically driven diet, what we can look at it from a different perspective is, one is how much we eat, second is what we eat. So when we look at the diet from a very scientific point of view, what we are looking at, what we eat, how much we eat and when we eat. Now coming to what we eat, which will include two major components: macronutrient or the foods that give us energy, and micronutrients, the foods that give us vitamins and minerals which are required for skilled activities. The macronutrients are mainly energy giving food, and we know three of them: carbohydrate, fat and protein. And micronutrients are multiple, like vitamin B12, we know vitamin A, B, C, D, E, and minerals like zinc, potassium. So these are the main components of the nutrition that we need to take. So this is what we eat. Coming to how much we eat, this is a question which will depend on how much you are using and how much your basal metabolic rate is. Now, a person who is working in the field will require different quantity of food than somebody who is sitting in office for the whole day. When we are talking from the reversal of diabetes perspective, a diet with 800 to 1000 kilocalories per day is known to cause the reversal of diabetes in around 10 to 12 weeks. There are multiple studies, but this is the one that I have found very useful. So how much we eat for reversal of diabetes for around 8 to 12 weeks, 800 to 1000 kilocalorie diet works best. After we achieve the reversal of diabetes, slight flexibility in the calorie intake can be done. Now, third point is, when do we eat? Intermittent fasting recently has been shown to be useful, but finally it should also take care of or make sure that what we eat and when we eat are respected. When what we eat and how much we eat are respected when we are doing intermittent fasting. We are doing intermittent fasting and we are eating 3000 calories per day with a lot of simple carbohydrates. This is not going to work. So we have seen how much we eat, what we eat, and when we eat. Depending on a person's ability to accept one particular food, one particular schedule of the day, and requirement of the basal metabolism as well as his physical activity, a diet personalized to a single individual has to be given. We have some general ideas like what I talked about, but this is not something that can be written or printed on a paper and given to anyone and anyone can follow and it will show results. We need a personalized plan for a given patient to show the most effective results.
I'm very glad to discuss everything with you, ma'am, about what is diabetes reversal, what are the different types of diet in diabetes reversal, and my favorite, what is personalized health goal.
Okay.
Thank you everyone for joining us, and we are looking forward to see you again.